A new survey of Americans showed that 85% of us say we feel good about our mental health status during the COVID-19 pandemic, but there's much more in these results. So to help us understand what they mean, we invite into the stream Anisha Patel-Dunn. She is LifeStance Health Chief Medical Officer, joining us from San Francisco. And one of the things your survey found is that 1 in 4 Americans report feelings of rage, and more than half, 58%, worry about the upcoming elections. So for me, where's the disconnect? Because if 85% say they feel good about their mental health status, but 58% are worried about the elections and have a sense of rage, that seems inconsistent.
Yeah, thanks, Adam. I agree with you. I think there's a couple factors here that play a role in the disconnect. I think that we as a culture, when we're asked how we're feeling, we say good, when really we're not very well able to articulate our feelings and emotions. So when we dig into the survey and ask more specifically about sleep or anxiety, it really is more apparent. And really what we're seeing across the country here at LifeStance, we're seeing a lot more people wanting to access care, new patients, and then even existing patients wanting to come in. It's very...
Anisha, I was just wondering, in terms of remote therapy, the rise of telehealth in psychiatry, psychology, and therapeutics overall, do you see this as being a trend that is going to outlast the pandemic, or is it something that we're already starting to see pare back just as practices, elective visits to the doctor start to pick back up?
Yeah, great question, Emily. I think, last time I was here, I think back in April, 95% of our visits across the country were teletherapy and telepsychiatry. Now we're seeing in certain parts of the country, Atlanta, Boston, Chicago, New York, people coming back in, more about 65% coming, are telehealth, and the rest are even more, about 35% of people wanting to come in. I think that that's something that we are going to see as a trend, that really this hybrid model of what people are going to come back to is that embracing the access to care, the easiness of access to care for doing a video appointment. But I do believe that people really do appreciate being able to come into the office and talk to people one-on-one in person.
Anisha, Dan Roberts here. For as long as certain people are still working from home and not going into an office, what is the responsibility of an employer during this time in terms of helping people with mental health issues? I mean, all companies send out a thing saying, here's the hotline, but that sort of has become the bare minimum. What do you think people expect from their employer?
Yeah, so I think that that's where, interestingly in the survey, people say that they don't reach out for help because they can't afford it. And I think the employer role here is helping with access to care. So, we, for example, are in network with most commercial payers and deal with a lot of large employers across the country. And so helping connect with employees, learning what their access is, what's their coverage. And I think employers being able to help facilitate that can be really key as we try to, manage our overall mental health across the country, and especially in the workforce.
Anisha Patel-Dunn is LifeStance Health Chief Medical Officer. Thank you for being here on The Move.
Hey investors, Zach Guzman here. Are you interested in learning more about the markets and getting the latest financial news? Well, then click right here to subscribe to our Yahoo Finance YouTube channel. Get the latest up-to-the-minute market analysis, big interviews in the world of finance, and information on how to manage your money every day wherever you are.